towards the beneficiary. So it's not really geared towards the clinical person or a person that's working at an agency, but a lot of this information will be helpful for you that you're able to share with your clients. And also at the end of this presentation, I will share a list. I will actually email it out later to Vivian of all of the volunteer coordinators and their sponsors units that handle the SHIBA program in Eastern Washington. So that will be very helpful for everybody on this call. So again, my name is Monica Kudrna. I am the SHIBA program coordinator for Spokane. I cover Spokane County, Whitman County, Asotin, and Garfield. I lead a group of volunteers that give free, unbiased information regarding Medicare. So what my volunteers do is they actually do one-on-one counseling with clients to help them navigate through Medicare. And this presentation today is, going to be your basic understanding of Medicare. And so all of our volunteers have gone through extensive training. There is a 2-day boot camp that they have to attend. They have to pass a certification through Medicare CMS to have them approved to be an advisor. And then in addition to that, there is about 10 to 20 hours of mentoring that they do. So it's observing calls with another seasoned advisor before they just get released. And then there's continuing education that they are always having to do every month, which is mandatory. So this is a pretty extensive volunteer group, and it's a lot of hard work that they put into it. And as you can imagine, it can be quite difficult. So we are here to help anybody that's got questions. So if you've got clients that are transferring over from Medicare, from being 64 and are navigating into Medicare, please refer them on over to us. Again, we're unbiased, so we can't recommend any particular insurance company, but what we can do is educate them on what's available for them. And with Medicare, it is not a one size fits all. Unfortunately, it's geared to each individual person, so their needs of their spouse may be something different than what they need. So the SHIBA program is sponsored locally by Aging and Long-Term Care of Eastern Washington. AllQ has been the sponsor now for, over 10 years, so quite a long time. And there is a SHIBA program within every county of our state. So if you are working with a client that is on the west side and you need assistance with their Medicare, let me know and I can get you the phone number for them, but I will provide you with all of the East Side volunteer coordinators. If you are working with somebody or maybe a family member of yours needs assistance in another state, the SHIBA program was called SHIP in other states. So there is a database that's got all of the SHIP phone numbers and their sponsor agencies. I can find you a phone number in every county and every state that we're in. So this is a great benefit that our federal government gives out to the public. So with further ado, I'm going to go ahead and get started in today's presentation. Now, again, this is geared towards the beneficiary. There are some things that may not pertain to you, but you'll understand it and explain it to your clients if so needed. So what is SHIBA? SHIBA stands for Statewide Health Insurance Benefit Advisors. We are a free program of the Office of the Insurance Commission under the Consumer Protection Program. Our volunteers give free, unbiased, and confidential information regarding Medicare, and we can assist with other insurances. Though we are not trained in them, we know how to navigate through them and how they work with Medicare. So we get a lot of clients that are on PEB or SEBB. We get a lot of clients that are TRICARE for Life and the Railroad and the federal government. So we know how they work with Medicare. We just can't particularly give them any guidance on those plans, but we can show them how to get to their website and that sort of thing. Our main focus is that we are an education service. We want to make sure that everyone is aware and educated and know what is available for them and their needs. And we do not sell you anything, nor can we recommend any particular insurance agent here in Spokane. If you're coming into us, if the client comes in and says, I would like to know more information regarding Medicare Advantage plans, specifically United Healthcare or Humana, then yes, we will give them information regarding that agency or that company, but we cannot give them a recommendation like contact so-and-so at this number. We are not allowed to do that. So we give them the 1-800 number, and then we ask them to contact a local agent. Today's overview, it's going to be, it's about an hour and a half presentation. Normally when I do this to the public, will probably be more about an hour today. It can go a little bit more quickly since most of you are a little bit familiar with items. So today's overview, we're going to Part B, prescription drug plans, also known as D. C, also known as Medicare Advantage plans. We're going to be going over Medicaps, also known as Medicare supplement plans. Of course, there's always an acronym for something, another word for something. And then how and when to enroll in all of these things and help paying for these items. So we also have a program called MIPA. It's Medicare Improvement Patients Provider Act. And it gives the client the eligibility, the screening for eligibility to get help paying for their Medicare Part B copayments and prescription drug plans. That falls under the extra help or low income subsidy. And we'll go into details a little bit more about that. And then our volunteers also screen and educate on Medicare fraud. So there's a lot of things that our volunteers are able to help with clients. So I mentioned a little bit earlier, we also work with folks who are have an insurance employer as a retirement insurance once they retire. TRICARE, PEB, Boeing. We teach them how it coordinates with Medicare, though we cannot give them anything regarding their specific plans, and we can help navigate to their websites. A lot of them are really, like PEB is very confusing. And so help navigating the client, telling them where to go, maybe showing them where some online videos are at, where the forms are at. They all need assistance with that. So we can help with that part. And then we ask them for any specific questions for them to reach out to their retiree plan benefits administrator to get the details on those particular plans. We also tell clients, as you're going through your Medicare journey, for them to keep a notebook, for them to write down names of who it is that they spoke to and the dates, and a little bit about their conversation, and for them to make copies of their paperwork. And for sure, make sure we educate them on fraud. Don't want them to give out that Medicare number to somebody that could compromise it, because they do not get issued a new number. What's issued to them is for life, just like that Social Security number. So Medicare is for folks turning to the age of 65, or they could be issued Medicare after they have been on Medicare on Social Security disability for 24 months. On that 25th month, they're eligible for Medicare. Folks can also be on Medicare if they have end-stage renal disease, also Lou Gehrig's disease. And then a beneficiary has to be in the country for permanent residence for a contiguously of 5 years. So they can't be here for 3 and then leave, go back to their country and then come back. They have to be here for 5 contiguous years for them to be eligible for Medicare. Medicare is administered by the Medicare and Medicaid Services, also known as CMS. It is administered or you enroll through the Social Security office. They handle all the paperwork for Medicare and the Medicare takes care of the rest. And then if somebody is retired railroad, then the Retirement Railroad Board would take care of their Medicare. Generally, Medicare pays 80% of the medically necessary approved amount. And then the beneficiary is responsible for 20% of the balance. We're going to be talking about 4 parts of Medicare. Part A is the hospital insurance. Part B is medical. Part D is your prescription drug coverage. And then also there is Part C, also known as Medicare Advantage plans. They are all exclusive, which means they cover your Part A, your Part B, and your prescription Part D. I call those a one-stop shop. Makes it a lot easier to remember that. It's got everything there for you. We use this map quite a bit with our clients. This is a really simple way of navigating how folks can get their Medicare. So your first step is to roll into Medicare Part A and Part B. I'll explain a little bit later on this presentation how we go about doing that. Step 2 is decide what path you want to go. We're going to start with the left-hand side for now, this side right here, and I call this side a la carte. Everything is purchased separately. And on the right-hand side is Medicare Advantage plans, or Plan C. And this is what I call the bundled unit, where everything is administered in one-stop shop kind of thing. Oh, we're going to be talking about the left-hand side, which is enrolling into Medicare Part A and Part B. Going to be going over prescription drug plans and then Medicare supplement plans. All of these are purchased separately. So when you enroll into Medicare, you if you've got enough work credits, then you will get your hospital Part A for free. What the Part A covers is hospital inpatient, skilled nursing facility, home health care, and hospice. Now we can dig way down into the weeds of all of these. For sake of time, I'm not going to do that here today, but I have got specific pamphlets and booklets on each particular of these subjects of the hospital, skilled nursing, home health care, and hospice. If you ever need any of that or want to know a little bit more information, please reach out to us. We've got documents that we can send out via email or paper versions of them. Then the other piece of it is Medicare Part B is your medical insurance. That's going to cover the patient's doctor's visits, outpatient hospital services, clinical lab tests, durable medical equipment, and then it also covers preventive services. So your hospital Part A, normally we see that it's free. People have worked enough credits through Social Security, paid their FICA taxes in order to get their Part A for free. There are some folks that, for whatever reason, weren't able to do that. And so then they would have to pay for Part A. And in 2022, that cost has went up quite a bit for Part A. It went from $274. Oh, I'm sorry. It'll cost either $274 or $499 a month. It's just going to depend on the work credits. So Social Security is the one that does the determination of what the cost of that would be for folks. If they are on any of the helping programs, Medicare Savings Plan programs, which I'll talk about a little bit later, if they qualify for any of one of the 4 Medicare Savings Plan programs, they could have the state pay for their Part A for them. And Part B is the medical. Last year was $148.50. This year it went up to $170.10. So that was a pretty big increase. I have been the Sheba program coordinator here for 4.5 years, and I was a coordinator prior in another state. And this is the first year I've seen it jump up that high. It's usually been a good $10 or a couple of bucks that it's gone up, or I've seen it go down, but this is a pretty significant jump. There are some folks that might have to pay a higher premium, and that determines on their earned income or their IRMA, which if they've sold property, or maybe they've got an inheritance, they might have to pay a Part B that's a little bit higher, or they've got more of a retirement. They could have to pay for a little bit more of a Part B premiums as well. There's also deductibles that fall in play with all of this. So the hospital Part A deductible is $1,566 for 2022. And then Part B deductible went up to $233. And then the beneficiary is responsible for 20% coinsurance and copays after Medicare has paid their portion. There are some few things that Medicare does not cover, and this is original Medicare. They do not cover eye exams and eyeglasses, though if they are being treated for cataract surgery, they do cover only the glasses. There is no routine dental coverage either. Cleanings, fillings, crowns, all of that. Medicare does not cover any of that, nor hearing aids, and then most alternative medications. So acupuncture and naturopathy. The acupuncture, there has to be a specific diagnosis, and for that lower back pain only. That's the only way that Medicare, original Medicare, will pay for it. And then Medicare does not cover any long-term care insurance. Any questions on that first part?
Hi, this is Joey. I do have a question for you. Can you hear me okay?
I can, Joey, yes.
Oh, good. Thank you. I actually received a question this morning from case management in regards to a patient not having enough working credits for Medicare Part A and only has Part B. Is that something that can happen?
It can happen, absolutely. And depending on what their income status is, if they are low income, the Medicare savings plan may buy their Part A. So Medicaid has a unit called the buy-in unit. They would buy the client's Part A if they fall within the category of the Medicare savings plan eligibility. So yes, that can happen. And they would just be granted a Part A a little bit later on, like a month or two later, if we are able to bring it to the attention of the buy-in unit with Medicaid.
Okay, thank you so much.
You're welcome. Great question. All right, so we're going to go ahead and move forward. The next section is Medicare enrollment. How does this all happen, right? For some folks, Part A and Part B automatically happen if they're already receiving Social Security retirement benefits. So if they applied when they were 63 or 64 to start drawing their Social Security benefits, then they will automatically be sent their Medicare card. They will automatically get it in the mail, and then they need to take action to get their Part D or purchase a Medigap or get a supplement or a Medicare Advantage plan. So that time it will automatically happen. If they are under the age of 65 and Medicare has deemed them disabled, that they have to wait 24 months, and on that 25th month, they will automatically be enrolled into Medicare. Again, they will automatically be getting their card. Some instances, this is just some different scenarios. Some folks are on Social Security disability on their super low income. They may auto enroll into, the state may have auto enrolled them into a Part D plan, prescription drug plan. And then a lot of times they are like, nope, I don't want that. I want to have a Medicare Advantage plan. They're able to make a switch if they want to, but they have to do it within their eligibility time, which is their special enrollment period or their general enrollment period time, whenever they've come into Medicare. So if you're 65 and you're actively working and you've got coverage through your employer and you're not drawing Social Security, then you need to actively enroll into Medicare. You do that through the Social Security office. A couple of ways to do that now is preferably is they send the application online. Everybody should have a socialsecurity.gov account. We've all created one ever since we've all been working. It's good to maintain it, take a look at it, see when our benefits are going to happen for us. And then once you become eligible to sign up for Medicare, then you can enroll and do that paperwork online. Other ways is over the phone. You can set up an appointment, and they are now open to the public, and they are asking folks to make an appointment online or with an agent or something. But they are asking them for appointments. So it keeps the lobby area there not so booked with people. Couple of ways to get a hold of them. Go to socialsecurity.gov. There's the 1-800 number, and you can physically go there. Couple of enrollment periods that are really, really, really important. First one is the initial enrollment period. This is when a beneficiary is turning the age of 65. The other enrollment period is general enrollment period. This is when you've missed your initial enrollment period. So there is a certain time of the year when you can only enroll into Medicare if you've missed your initial enrollment period. If you have to wait for general enrollment period, that could also mean that you've acquired penalties. So each scenario is a little different. And then there is another enrollment period called special enrollment period. And this is for folks who have continued to work past the age of 65, have credible coverage through their employer, and or have moved, or maybe they've lost coverage, maybe their insurance or their special coverage has been lost or terminated, then they would get a special enrollment period. For folks that are on the initial enrollment period, these are the ones turning the age 65. The ideal time that we like for people to go sign up for Medicare is 3 months prior to their 65th birthday, right here. That allows our government enough time to process their paperwork. So the month of their birthday, they have coverage. Okay, so there's no gap in service. That's what we are looking for. We don't want a gap in service. Now, there are folks that we see that they totally forgot that they had to enroll. And if they rolled into Medicare the month of or the month after the birthday, it's going to start the month after that. So, and that could cause a coverage gap for some folks. So it is important for them to do the paperwork early, get their stuff in place early. And so there's no gap in service. Now, the general enrollment period is January 1st through March 31st. And these are for folks that have missed their initial enrollment period and they don't qualify for a special enrollment period. And currently right now, the rules state that if they enroll into general enrollment period between January 1st through March 31st, the Medicare doesn't start until July 1. So they're still going to have a gap and they're going to acquire penalties. Okay. I do have good news for next year, that is going to go away. The Medicare benefit starting in July, it will start the next previous month, which is going to be great. So if they've missed their initial enrollment period and they have to enroll in January, they don't have to wait till July for their stuff to start. It's going to start the very next month, which is great. And then that will not have them acquire so much of a penalty. They may still get a penalty depending on how long they've been without coverage, but at least they will start getting health care right away and not having to wait 6 more months, which is great. And that's going to be effective next year, 2023. So the special enrollment period, those are for folks working past the age of 65. They have to be actively working and or be on their spouse's employer coverage plan. So that also counts as well. And they can delay getting their Part B if they want to. So each scenario is a little different. So they can enroll into Part B once they lose that employee coverage. Or if they were on a spouse's coverage, if he retires or she retires, they retire, then they would be eligible to get a Part B at that time. So during the 8-month special enrollment period starts when the active employment ends or when the health coverage of the employer ends, whichever happens first. And that's the 8th month for them to enroll into a supplement plan. If they are wanting to get into a Medicare Advantage plan, or they need to get a Part D, they have 63 days to do that once they get their Part B going. So they need to be mindful of the dates and the times so they don't require a penalty. And if you're non-actively working and you're covered by an employer plan, you do not need to sign up for Part B. So if you turn the age 65 and you're still working, you've got credible coverage through your employer, you're happy-go-lucky, you don't plan on retiring for the next 5 years, just apply for your Part A. Makes it one step easier for you to get your Part B, and you're good to go. If you are non-actively working, but have coverage through your spouse's employer plan, you may not need to get Part B either. So long as you've got credible coverage through you or your spouse's plan, you're good to go. The other thing that we also ask is for them to check with their benefit administrator, because this isn't a stand-all rule for everybody. There are some plans where you may be paying for your employer plan, and it could be really expensive, and it could be a lot easier for you to be on Part B. I don't see a lot of them, but it is out there. So we educate folks and tell them to, do a little a math sheet and figure out what the cost is for you and your spouse, and then how much it would be for Medicare, and kind of go that route. If you are not actively working, you do need to consider to sign up for Part B, unless you've got a very unique situation. But it is recommended that you do sign up for Part B. In order to purchase a Medigap policy or a supplement plan, you have to have Part A and Part B. Same for a Medicare Advantage plan. And if you are a retired military member and you're going to be getting TRICARE for life, you must have Part A and Part B. And then some employers make you take Part B. So they're like, nope, you're not costing too much for our plan, but it is now required for you to get Part B since you are now age qualifying. So do ask your healthcare administrator. And your Medicare card. So if you are going to be accepting Medicare, you'll want to be keeping your card. You don't need to mail it back. They'll mail it to you automatically for those that are already drawing Social Security. Now there are incidents or scenarios where they could be drawing Social Security and then they could be on their spouse's employer plan. Social Security, Medicare doesn't know that. So if that's the case, then you can defer your Part B, return it back, and then they will reissue you a new card to get your Part A only. On that Medicare card shows when your coverage starts. So you've got your Part A date and your Part B date. And a few years ago, they've changed the Medicare number. It is now an alphanumeric number as issued by a computer. It's no longer our Social Security numbers on there. If this ever gets stolen or you've lost it or you've run into any clients that need this printed out again, few ways that they can get this. They can log on to their Social Security account and print it from there. They can contact Social Security and they can reissue one. You can contact Medicare. You can log into Medicare.gov if you already have an established account, and you can give us a call. As advisors, we have a unique ID that can call Medicare on behalf of a client and ask for them to reissue a Medicare card. So that comes in really handy as well. It does take Medicare about 30 days for them to reissue you a new card. And you will get a letter of notification or a letter of ability that you've got Medicare if you so need that. We also have access so we can get their Medicare number if they needed to enroll into a plan and they're short on a deadline, we can request that as well. And of course, with all of that, we want to make sure that our clients are aware of scams, to only give out that number to particular, to facilities that need it, like your doctor's office. We ask us as an exception to the rule as a SHIBA advisor. And then Medicare and Social Security will never call you unless you've got an appointment with them. Any questions on that particular part?
Hi, this is Joey again.
Yes.
I had a question about the penalties. Is that something that you might talk about a little bit later that I should hold off on? I have a hard time trying to help patients understand when and how to make those penalty payments, and because I don't know how to do that and how to advise them. So I don't have a phone number or anything like that. I was hoping to get that kind of information from you.
Yeah, so I can definitely send an email out with that particular information regarding penalties. Usually, so it depends on the scenario. If they've got a Part B penalty, it will be attached to their Part B, which is going to be withdrawn from either from their Social Security check, or if they're not drawing Social Security yet, then they can make a payment for their Part B to Medicare. And there's all different ways of accepting payment for them. If you need that, I can print out a list of different sources of how they're accepting payments and where to send that to.
That would be wonderful. I do appreciate that. Thank you.
Yes, absolutely. And then if they're a client that's got a penalty because of a Part D plan, usually that's a case as well. If they have a penalty with Part B, they're going to have a penalty with the Part D prescription drug plan as well. And then that penalty will be added on to their Part D premium cost. And then that will either be paid for usually through a direct payment to the plan, or it can be deducted from their Social Security check.
Awesome. Thank you so much.
You're welcome. All right, the next portion we're going to be talking about is Medicare prescription drug plans, Part D. So that first sentence always makes me kind of like, It says Part Ds are optional. Yes, they are optional. No one's telling you you have to sign up for one. But if you choose not to, you will get a penalty for every month you could have had it and didn't get it from the time you're eligible to enroll. It's part of the insurance pool, so you want to keep the cost down for the premiums. They want you to enroll when you're eligible. And the penalty comes in because you've gone so much time without it, you need to pay the penalty to keep the pool down. So that's the reason why they do that. The Part D coverage is for standalone plans only. They work with Original Medicare. And most, but not all Medicare Advantage plans have a prescription drug coverage. So one thing that clients need to be aware of there are Medicare Advantage plans that only sell the copayment piece of it to see your primary doctor. They do not have a prescription drug coverage added on their plans. And on Medicare.gov, the writing is really small. So I've had a couple of clients enroll accidentally in that, not knowing that they've done that. And then after open enrollment is over and 2 months later, they go and get prescriptions filled at the pharmacy and they find out they don't have a prescription drug plan. Fortunately, there's nothing that can be done at that point. Well, there can be. Now that there is a Medicare Advantage plan open enrollment time as well, they could make a switch and then they could change plans the next following month. But the Medicare Advantage plans without prescription drug coverage is really geared towards folks that are on TRICARE for life, because they can get their prescriptions filled through the military, or if they're a veteran, they're able to access the extra benefits of a Medicare Advantage plan and not to get their prescriptions filled through them. To enroll into a prescription Part D plan, you can have either Part A and or Part B. It doesn't matter. So with that client that you had, Vivian, or no, it wasn't Vivian, I forgot who it was. If they're eligible for if they got Part B, they should also have a Part D. They are eligible to purchase a supplement or a Part D plan. And they actively have to enroll in one. There are times where folks get auto enrolled into it. And those are folks who are usually already on Medicaid to begin with. And then they turning 65 and the state auto enrolls them. So not sure how that part works. I've just seen it a lot. And so I always ask if they've gotten anything in the mail when I'm counseling with them. The Part D plans do not work outside the US. So this is for US area only. And if you have a drug coverage through your employer plan, you may have credible coverage. So this is the ones for folks working past the age of 65. The credible coverage is what falls in. So they've delayed getting their Part B. They are now retired. They now want to get their Part B. And they have to show proof that their coverage is good or better than Medicare's. There is a form that the insurance plan will have you fill out or have the client fill out saying, hey, did you have credible coverage? You've got a 5-year gap here, and you would supply the credible coverage letter saying, yes, this is when my employer plan started. This is when it ended. And then you return that back to the Part D plan. And then it will waive that penalty. So you do need to supply that. If you don't supply it and show proof that you've had credible coverage, you're going to get a penalty. So the enrollment times for Part D is in your initial enrollment period when you first turn 65. Another thing that we tell our folks quite a bit is open enrollment time, October 15th through December 7th. That is the time when they want to review their plans, either their prescription drug plans or their Medicare Advantage plans. They can save themselves lots and lots of money for doing that. There's so many things that changes throughout the year. So we educate folks when they come see us the first time, and then we remind them, hey, don't forget to come see us October 15th through December 7th. Those plans then become effective January 1. And then on a Part D plan, they also get a special enrollment period if they've moved outside of their area. So they move to a new area, usually within Washington State. Normally it's all covered. So the plans that we have is for the entire state. Usually what might change is where they go get them picked up at their pharmacy. Their favorite pharmacy may not be in network anymore. That may not be available to them. So that might change. And then if they've moved to another state, they have a whole other sets of enrollment or plans there. A special enrollment could also be they gain or lose their retiree coverage, or if they've got extra help or a Medicare savings plan, they can make a switch once a quarter. And then to enroll into a Part D plan, they can give us a call. So this is what our volunteers do is we'll sit down with the client. We'll get a list of their prescriptions. We enter them into the Medicare Plan Finder, which is on Medicare.gov. We answer a little bit of questions that are on there. We put in the pharmacies that they like to pick up their prescriptions at. And then we give them the top 5. We rack and stack them. The computer does the analysis of the cost of the prescription by the lowest cost of the premium and the cost at the pharmacy. And then we go over in detail with the client which one would be the best choice for them. They can also do this by going to Medicare.gov themselves if they're computer savvy. They can call the Part D plan in general if they want to do that. They can go to the Part D plan website, and they can also call 1-800-Medicare. Any questions on the Part D?
I have a question. I have veterans. I help as a care coordinator, and I learned that at age 65, they can't use the veterans services anymore. They have to use Medicare. But I also know that they can use the pharmacy, because my client does, but he also uses care in the community. I was very shocked to find out veterans can't use the VA programs after 65.
That's interesting. There may be a little bit more to that. For how I understand it is it's by service related of what their injury is while service. So they may have different levels of care. And maybe that facility can't handle a whole lot. Maybe it's just for active duty or certain levels of care. Then the rest is sent out to the community. That could be it. They do recommend that folks get on a Medicare Advantage plan or get a Part D plan. And the reason being is that they don't ever know what's going to happen with the veteran dollars. It could go away tomorrow. We don't know. So we don't want the folks to be without any healthcare coverage. But that's a good question for maybe somebody at the VA that could give a little bit more of an insight on why they're doing that in your community.
Well, I have Nadine Newman, who's in Yakima, works for the PFW, who is my contact that I find out a lot of things about. And this was through my veteran client being very angry getting hospital bills while he was in the hospital. He has, because I use the same program, Care in the Community, where the VA pays for you to see your local doctors and you don't have to go to the clinic. But when he went into the hospital, that's not covered by that, and Medicare took over. And then what she said was, well, VA used to be the first payer back before 2018. And then now VA will pay last. And so we ran it through Medicare, and then I called up the hospital and adamantly insisted that they also bill the VA at the very end, which of course will only pay exactly what Medicare pays. But I don't know if he also has a Part D. I will have to ask him. Is that something he should also have then and pay for that?
It is recommended, but if he is getting his prescriptions filled at the VA or having it mailed to him, that's perfectly fine as well.
Okay, because I know that he hadn't used his Medicare for a long time. So when he started using it, he was not familiar with how that works. So this will help also explain that he doesn't have to stick with what he's got. So thank you. Right. Yes, you're welcome. And yes, when they turn the age 65, Medicare is the primary payer. And then the last resort is going to be VA, or Medicaid would be the last resort. Usually also too, if they are admitted into the hospital, there is a number that the client can call, or the coordinator at the hospital for VA services, to let them know, hey, this person's in the hospital now. And so they're aware that there could be a bill coming as well. So there is that option too. Yes, and I don't. Oh, I'm sorry, the internet cut you out. I think that sometimes they don't know at the hospital to call. Oh, sure. And that's been a big issue of education. There's so many people who don't understand VA paperwork, and I barely understand that. It's nuts. But I guess so. My client is 84, so he'd been using VA before 2018. So I'm just trying to navigate when you have both is been confusing for me, trying to explain how those work together. So Medicare is your primary payer, and then your VA would be your second. And usually if they have to correspond, so it depends. They may have to send the statement, whatever's left over, to the VA. They may have to manually do that, or take it to their caseworker, or it's done automatically behind the scenes, that Medicare shows that the VA is the last payer, and it happens behind the scenes. Okay, yeah, I'll just keep on. He shows me all of his bills. So for him, it's been pretty straightforward because he's like, I got another bill. You've got to come see this. So sometimes they're EOBs, so which I'm always glad to see. So okay. No, that and I'll work with him on understanding the system on that. Thank you.
You're welcome. All right, great questions. Next piece is Medigaps, also known as Medicare supplement plans. This is the last piece of the arrow. And Medigap policies are sold by private insurance companies. They help fill the gap of Medicare. So that 20% that they're responsible for, this is where the Medigap policy picks up. The different plans help pay for deductibles, co-insurances, co-payments. It all depends on what letter of plan that you choose. In Washington state, the Medigap plans are standardized, meaning they have the same letter, has the same coverage. The only thing that's different is the cost. So this is what I'm talking about with the letters. You've got A through F. These are the different letters of different policies that are sold. On the left-hand side are the benefits or what those policies cover. And the check marks is what it covers in that policy. So currently right now, the most comprehensive is Plan G. It covers everything but the Part B deductible. And the cost of those run anywhere from $150 a month on up. They're all different by different companies. It's going to be the same benefits. You just have a different vendor selling it. Okay. Now the C and the F are no longer available for purchase for those new into Medicare, like turning the age of 65. So if you've turned the age of 65 on or after January 1st of 2020, you are no longer eligible to purchase the C and F. They're fading those out. The next best thing is going to be Plan D and Plan G, and you can also purchase a high Medigap policy of Plan G as well. The best time to enroll into a Medigap policy is the first 6 months of after you've become Medicare eligible, when you've gotten your Medicare Part A and your Part B. Those first 6 months, the Medigap policies cannot screen you for any pre-existing conditions. You've got guaranteed issuance, this is the once in a lifetime situation where it doesn't matter. You could be turning the age of 65, is eligible to purchase Medigap, and you have cancer. They cannot deny you because you have cancer. So this is your open opportunity for this. If you've passed that window time frame, that 6 months of guaranteed issuance, and you waited maybe a year later, 2 years later, and you're like, gosh, I'm going to the doctors a lot with this Medicare Advantage plan, or I'm traveling a lot and I'm not getting care that I needed through my Medicare Advantage plan. I want to get a supplement plan. They could sell you one, but you would have to have a health assessment and they may or may not accept you. So there is some risk at that. And then for folks under the age of 65, there is no guaranteed issuance. There are 2 Medigap policies that's available for those folks. It's very expensive. But once they turn to the age of 65, it opens up a whole new window. Then they've got a guaranteed issuance to purchase a supplement plan if they want to. The Medigap policies only work with original Medicare. And the things they need to consider is there's the cost factor of it. The other kind of a pro to having this particular route of getting your Medicare is you've got the freedom to choose whatever doctors you want to go to. So as long as they accept Medicare, then your supplement plan will pick up anything depending on what policy you pick. So they'll follow Medicare's rules. If you choose a supplement plan, then you're geared to seeing the doctors in network, and they may not work within another area of the state. So let's say, for instance, you live in Whitman County and you want to go see a facility here in Spokane, you need to see a specialist, or let's say you need to go all the way to Seattle. With Original Medicare, you're able to do that. Wherever they're going to accept Medicare, you're able to do that. With the Medicare Advantage plan, there may be restrictions. You could be out of network. And then some Medicare Advantage plans have it available, so you could travel, but there may be something that you have to sign up for. So those are things that we teach people to be aware of. And then all of this is costs money. So your Part B deductible is a fee. Your premium of Part B, your premium for Part D, prescription drug plan, the cost of medication at the pharmacy, and then your cost of your supplement plan. So can you afford all of that? That's another factor that we teach people. So you kind of just determine, we write it all out for them. They have them do a quick analysis, or they take it home. They may think about it. They may ask their friends. They also look at their health. Is this somebody who's fairly healthy, or do they have a long history of cancer in their family? We buy insurance for the unexpected, right? So we talk about all of that. To enroll into a Medigap policy, clients do need to contact a licensed agent. We have the entire list of the state of the parent companies, and if they want to reach somebody local, they would need to contact that parent company and ask for a local insurance agent. There are no open enrollments for Medicare supplement plans. If you enroll into one, you can switch at any time. There's no time period in that. They do not carry any dental or any vision. Some of them do have a fitness package to them, or you could also get like a bundle, like if you and your spouse are on the plan, then you're able to get maybe a discount with that. Any questions on the Medicare Advantage plans? Or supplement plans, sorry. I saw the Medicare Advantage plan slide. So Vivian, I think we might go over our hour. Are we still okay?
Yes, I just have a hard stop at about 12:20.
12:20. Okay.
Mhm.
And I will go through this. This other part should be fairly
Okay.
straightforward. All right. Thank you, Vivian. All right. Medicare Advantage plans. That was on the right-hand side. That's the combination. It's got your Part A, your Part B, and Part D all combined together. You have to have Part A and Part B in order to enroll into this. They are sold by private insurance companies. We have a complete list of all of the insurance companies that are for Spokane County. Each county has their own. Some have some do not have any. So if you want any particular ones within your particular county, please reach out to me. Be happy to supply you with those, or reach out to your volunteer coordinator in that area. They'd be happy to send that over to you. The Medicare Advantage plans, you need to see doctors in their network or in their hospital, in their county. And they do not travel well outside the Spokane County or the county that the client lives in. So just be aware of that. And then some counties don't offer any Medicare Advantage plans at all. And we've seen more of the rural areas carry at least one or two. So they are getting in there. The other piece is, are the clinics accepting them? Are the clinics having them now as an option? So I think as we're progressing forward, this is Medicare Advantage plans are affordable. So we may be seeing more of those in our rural communities. They have the same rights and protections as Original Medicare. They include the Part A and the Part B in there, and the prescription drug plan. So your Part B cost still comes out of their client's Social Security check, or they have to pay manually. And then if there is a fee for the Medicare Advantage plan, that's either deducted from their Social Security check, or they manually send a check in. A lot of these Medicare Advantage plans have extra benefits to them. So that's why they're very attractive. They have vision, they have some dental, they have hearing. There are also programs for those that are on Medicare and Medicaid, and those are called Medicare dual complete plans or special needs plans for the Medicare Advantage plans. And those have a significant amount of beneficial for folks that need dental. Some of them have wellness cards where they can go buy groceries with it, or they can buy over-the-counter supplies. They're really beneficial for folks that are low income. We help folks a lot with these particular plans. And they may have to may get a referral to see a specialist if they're on these plans. When you're on original Medicare, if you want to go see a specialist, go see a specialist. With a Medicare Advantage plan, you don't have that option. You have to ask to see if they will accept the plan or where you're going. Medicare open enrollment, they want to review these plans every year. A lot of plans, a lot of clinics drop plans. They may accept them, may not. They need to check with their doctor's office to see if they're still going to be accepted for the next following year. And then your initial enrollment period is when you first turn 65. That's when you're eligible to enroll. And when you're on a special enrollment period, you're able to enroll into a Medicare Advantage plan as well. A couple of years ago, Medicare has created a open enrollment for Medicare Advantage plans. So we have our open enrollment period, November 7th. I'm sorry, December. I lost my train of thought. October 15th through December 7th. There we go, Monica. And then you have your open enrollment period for Medicare Advantage plans, January 1st through March 31st. So they may be able to, they find out that their doctor is not on the plan. They didn't do anything during special enrollment period. They find out that their doctor is not in their network anymore. They still have the opportunity to make a change during this time period, which is great. Or maybe they've moved to a new area. Maybe they moved from Spokane to Whitman, and Whitman doesn't have any Medicare Advantage plans that they had in Spokane. So they are able to make a switch. To enroll in these, our advisors can help. We do the same thing as we do for the Part D. We do a comparison with the prescription drug plans. We go over co-payments, and then we can enroll them online, or we can have them go directly to the Medicare Advantage plan site. They can go to medicare.gov. They can call Medicare. Quick questions, anything on that?
Hi, this is Gail in Kittitas County again. I have a lot of clients that have Humana and nothing is offered in our county, but it made me think that I should ask if they've moved in, or is that just like crap offered where you live that doesn't have anything to do with where you live?
Well, it's a national commercial that they put out there for everywhere, and people call it, and they sign people up, and the agents maybe didn't screen them on what doctors they're going to and see if they're covered in that area. Or maybe they've gotten a flyer in the mail and they called. That happens a lot with the Humana.
Can I suggest that during open enrollment, they look at that?
Absolutely. Absolutely.
Okay.
Yes, absolutely.
Because a lot of them are you're like, oh yeah, you need that, but Humana doesn't cover that. It's not here. And a lot of them aren't people that drive anymore. You know, they can't go where they need to go. Oh, I'll put that as my fall agenda with my clients.
Yes, they need to review their plans. And then they also want to make sure, you know, I've seen this a lot where our seniors are lonely, right? Or they're watching TV at 2 o'clock in the morning. And boy, that ad is really, really persuasive. And I really want all those benefits. They need to make sure that that is available in their county. So a little bit of education to them up front, saying, hey, don't be calling anybody at 2 o'clock in the morning. Check, you know, first, you know, with your local nonprofit area that handles this kind of thing, and see if it is available in your area. Because we see a lot of that.
Thank you. Oh, it's not just me seeing that amongst my client. Okay.
No, we see it all the time.
I'm very happy that my mom has TRICARE for life. And
yes.
Yeah.
She's got the Cadillac of insurances. That's what they, and I will have that as well when I retire. My husband is prior military retired. So they call that the Cadillac of insurances. Yes.
Awesome. Thank you.
Yes. All right. So part A usually is free depending on the work history of a client. Part B, you usually pay for that through your Social Security. It's held within your Social Security check, or you can make easy pay payments, they call it. And it could be deducted from your checking or savings account. Medicare is with the times now. You can, shoot, I'm surprised you can't pay by PayPal or something nowadays, right? Part D, same kind of thing. You're going to have it deducted from your Social Security check, or you can have them bill you directly. And you can set that time up when you enroll into those plans. Same thing for the Part C. There's a screen on that Medicare.gov website that asks, how would you like to pay for it? So really briefly, the next piece I'm going to be talking about is the Medicare Savings Program. We screen here at Aging and Long-Term Care of Eastern Washington, we screen every client that comes through the door to see if they're eligible for this program. This program is from Medicaid. It helps pay for Medicare's cost. Super beneficial for clients. It helps pay for the Medicare premiums, and it can help pay for Medicare's deductibles and co-insurances. This income eligibility does change every year. Usually it changes about February and it becomes effective in April. And this is the eligibility for the Medicare Savings Program. So this is what we're currently looking at for 2022. This is the gross monthly income of an individual. There's different aspects of the Medicare Savings Program. There's 4 different tiers that they could qualify for. I'm not going to go into detail with those. If you would like to have a little bit more detail on it, I can be happy to share that to you via email. But do know that these are extremely important for our clients. It covers the Part B premium costs. It can help pay for the Part A. That's where the buy-in unit of our state pays for that. And it can help pay for the co-insurances that clients may have. There are resources, money in the like savings, IRAs, all of that is counted. There is a criteria that they have to be below of. And for individual, it's 7,860. Oh, I'm sorry, for 2022, it's 8,400. So that did an increase a little bit, which is good. This chart, the Medicare Savings Program does not count the a car and the home that they're currently living in. Okay, so those don't count. Now, if they've got 2 cars, they're going to count that second car, but their one main car does not. And if they've got $1,500 accounted for burial costs, that does not count as well. The other piece of a helping program is called Extra Help. This is administered through the Social Security Administration that helps pay for the cost of prescription drugs. When they go to the pharmacy, it could be anywhere from $0 to $9 and some cents. It's determined by Social Security, who makes that determination. You fill out the paperwork through Social Security. Now, if you're doing paperwork through the Medicare Savings Program, through Washington Connection, that is there's a box there on that form that you can have it directed to Social Security, and it's a one-stop shop. That form will look at both of those programs, and then they will get assistance with both of them. So that's really good. And here are the criteria for Extra Help. The resources is a little bit more gracious on that for folks. And it's a federal state insurance program for people who are limited income and resources. Age and or disability is what matters with this. So if you qualify, if you're on Medicare because of age or disability, your resources apply and everything counts, then you'll get some sort of help. But the Department of Social and Health Services are the one that makes the eligible determination. Every year this is reviewed by them. So I always tell clients, look at your mail, make sure that you keep up to date with your forms, your applications, because we don't want them to be dropped and then they have to pay for their $170 Part B premiums. And then they're not going to be able to get food, and it just goes to a terrible downhill spiral from there. So I always tell people, please look at your mail, please respond timely to any documentations that's needed from Department of Health and Human Services. And if you've got a client who is fairly close and have them apply, all they can do is say no. It doesn't hurt to do anything other than apply. Okay. Any questions on that part? Now, then this next part, you guys are all probably experts. You can teach me some of it. This is on Medicare and the Affordable Care Act with the Washington Plan Finder. And this is through Washington State. So it says, question, can individuals who already have Medicare enroll into a health coverage through the Washington Plan Health Finder? And according to this slide, it is no, it's illegal for someone knowingly knowing that they have Medicare to sell them an insurance policy through the Health Plan Finder. So what if I'm currently enrolled in a qualified health plan and become entitled to free Part A? You can keep your plan, but tax credits you receive will be discounted once Medicare Part A starts. Now, a lot of this stuff, when I get some weird questions like that, I would be calling Vivian, like, help, I don't know how this works. So coordinating together really helps on both ends, because sometimes we do get clients that say, I want to stay on that. I don't want to go on Medicare. Sometimes you just don't have a choice, that this is our government's insurance. They have a choice to not get Medicare Part A and Part B. In the long run, that could be harmful for them. And then the next question, what if I'm enrolled in a qualified health plan and become eligible to get Medicare Part A, but I can't get it for free? So this one is really tricky. You can keep your plan, but any tax credits or reduced cost sharing you receive will be discounted or discontinued once Medicare Part A starts. If you choose to only sign up for Medicare Part B, you can continue to receive the tax credits and reduce cost sharing. So it becomes a little tricky then. And what if I am currently enrolled in Washington Apple Health and get free insurance and then become eligible for Medicare? Your Apple Health plan will be discontinued. Once Medicare starts, you may be eligible for assistance via Medicaid or the Medicare Savings Program for extra help. So what happens a lot too is when folks are on Medicaid, they've got full Medicaid, then they become Medicare eligible. Medicaid used to pay for the prescriptions 100%. They come over to Medicare, now they have to pay. It's going to be a low fee if they're still eligible for the Medicare Savings Plan, but they're going to have to pay either $0 to $9 and some cents. So a lot of folks get very upset because they were getting it for free and they want to stay on that, but now they're age qualifying and now we've had to move them over. So I get that scenario quite a bit. And then the last piece of my presentation is Medicare fraud. We always tell folks to guard that Medicare card. Don't fall for those phone scams. There's tons out there right now. And I always remind folks to review the Medicare summary notices. There are humans that are doing the coding on that, and they make errors. And those are Medicare dollars for the rest of us. So we need to make sure that we educate our clients on how to read the Medicare summary notices, scan through them, make sure that the services we receive is what indeed they received. And if there's any questions on them, then they need to go to the billing department and then get it fixed. And then if they suspect fraud, they should report it. And we also help with that. Any questions? That concludes my presentation today. I know it's really long and there's a lot of information. All right, so Vivian, what I'll do is I'll send a copy of this presentation over to you, and then along with the contacts for Eastern Washington SHEBA programs. And then I will send you the email on the penalty piece of it as well, for the person in the audience.